It is truly an honor to stand amongst esteemed members of the University of Washington School of Public Health, our dean, department chairs, faculty, staff, alumni, current students, family and friends, and possibly most importantly, on this day of commencement, all of the 2018 graduates. Congratulations, everyone. Quick applause. One of the questions I receive on an increasingly regular basis is, how did you get here? Or why do you do what you do? And for good reason. My two young nieces, whenever I ask them what they want to be when they grow up, constantly change their minds from nurse to soldier to veterinarian, and most recently to cartoonist and cook. But never have I heard them say industrial hygienist, biostatistician, or environmental health scientist so they can monitor fecal coliform in water. For some people posing this question, how did you get here? I think they are just curious. Family and friends wanting to understand the why and the what of our chosen careers, while for others, they're looking for that formula that grinds out successful public health minds. But whatever the motivation, the response is undoubtedly very individualized. Now, of course, explaining that path, with all of the caveats that we scientists love so much, and carefully selected terms implying causality or the absence thereof, produce unique and fascinating stories. But ultimately, the one unifying motivation that I'm sure is present in each and every one of us is that we want to make a difference in the world. My path has led me to a discipline or field where we strive to protect the health and safety of workers and integrate a work perspective into the larger public and environmental health endeavors. As people, our occupations contribute substantially to our self-identity, our socioeconomic status, how and where we spend our time, the types and magnitude of exposures, and our ability to adapt to or mitigate potential hazards. We live in a world where workers not only continue to be exposed to traditional occupational hazards, but are also increasingly affected by changes to the work paradigm, a globalized economy, and a changing climate. As public health graduates, we are continually tasked not only to understand the science, the policy, the acronyms, of which there are many, of our own disciplines or passions, if you will, but also that of the many other fields that contribute to the vision of healthy people in sustainable communities, locally, nationally, and globally. This inherently interdisciplinary profession demands strong communication, a noble heart, remarkably creative minds, and relentless determination. During my education at the University of Washington, I opted not only to utilize the resources of the School of Public Health and the Department of Environmental and Occupational Health Sciences, but also those of the Program on Climate Change and other colleges within the university in an effort to strengthen my contribution to my field. The education and experiences we leave here today will help us continue on in our careers and generate positive change. As we work together towards mutual goals, ultimately, when the dust settles, or perhaps more appropriately, is effectively prevented or controlled through engineering or administrative controls, our true measure of success, the one we are all working towards, is a prevention of a death, injury, or illness, an outcome that is challenging to quantify and may sometimes go unnoticed. So, my fellow graduates, as you embark on the next chapter of your public health mission, let me be the first to thank you. Each and every graduating mind today has and will continue to make a difference, whether through integration of public health education into daily life, an existing career, innovative research, or other numerous avenues. I would be honored to work with each and every one of you today, and I look forward to the promising public health impacts of the class of 2018. Thank you.